Today I'm going to be answering your questions on health anxiety. Hi, I'm Paige Pradko. Welcome to Therapy for a Better Life. Before I get into today's questions, I want to thank you for leaving such great comments and questions on my videos. I think it is very helpful. It helps everyone, and it lets me know what you would like to know more about, what you'd like to hear a video on, and maybe what I've left out in a video. So please keep leaving those comments and questions. Now today we're going to start with a question from Kyle. Kyle says, any CBT tips for working out and exercising, specifically when your heart rate goes up? So I want to take a moment and just review a little bit about health anxiety. Health anxiety acts like OCD and it's treated in the same way. There are obsessive thoughts with health anxiety, and then there are compulsive behaviors that reinforce those thoughts and keep the cycle going. So what we need to do is stop the compulsive behaviors, right? Some of the most common compulsive behaviors in health anxiety include Googling and researching and seeking out excessive appointments, excessive doctor appointments and testing, perhaps going to the ER often, checking body symptoms like heart rate, blood pressure, and actual avoidance behaviors. What Kyle is talking about is a common avoidance behavior. Avoidance behavior can be avoiding exerting the body, right? And exercise. Also, there are some people that avoid doctors and hospitals and tests altogether. And many people even avoid going places where they think there might not be medical help there. They get very anxious. So there are a lot of different avoidance behaviors. But we're going to talk about exercise today. Now, CBT is cognitive behavior therapy. And there are different types of CBT. The type of CBT where we work with our thoughts and changing our thoughts or more helpful thoughts, that's not very effective in exposure therapy. What is effective is the type of CBT called exposure therapy. And so, Kyle, what I recommend is exposure therapy. And that means once you have your doctor's permission that you have the all clear to exercise, you want to really exert your body. And so I would say get on that treadmill or whatever you're going to do, biking, whatever, weightlifting, whatever you're going to do, and exert yourself. You will be anxious when you begin if you've been avoiding it, but that's what you need to be in exposure therapy. You need to be a little anxious when you start. But as you go through the exercise, your anxiety is going to be dropping. It might not drop altogether the first time, but it's going to drop a little bit. And then you have just taught your brain that you can exert your body. The more often you practice that, the more the brain will learn that you can exercise. And really, truly, after several times of doing exercising, your anxiety is going to come down a great deal. And it will not be an avoidance behavior for you anymore. So great question. Thank you for asking that. The next question is from Bubba Mara. How is it possible that you miss out on mentioning the avoidance type of health anxiety? And in my first videos on health anxiety, Bubba Mara is correct. I did not mention the avoidance type. And I apologize for that because people with avoidance health anxiety are really suffering. They have a lot of fear about being in any kind of medical setting or getting any tests. It's kind of like, if I don't know, it won't hurt me, but there's a lot of anxiety involved. And your treatment is going to be behavioral exposure therapy. You could use some scripts as well. I have a video on how to write and record a script for OCD. You can visit that video and learn how to do that. At the end of this video, I'm going to read a script on health anxiety to give you an idea. But your main treatment is going to be behavioral exposures, where little by little you get yourself tolerating the anxiety to go to the doctor's appointment and make that appointment. And so little by little you will work on that behavioral exposure. But great question. Thank you for asking that. Jennifer asks, I'd love to hear more about how to help a partner who suffers from illness anxiety disorder. It's distressing knowing that reassuring the concerns only keeps the cycle going. And it can be hard to be perceived as not caring by not responding in a sympathetic way to the constant health queries. Jennifer, this is such a great question. Everybody that cares about a person with health anxiety struggles with what to do. And if I'm treating someone with health anxiety, I do ask them to talk to their family members, talk to their loved ones, and let them know to not give reassurance. And it is so difficult, but reassurance makes it worse. And so there needs to be a conversation that it is worked out on what will be said if the person with health anxiety is seeking reassurance. And it may be something like, I know that you are suffering right now. I know that you're anxious. I love you, or I care about you, but I cannot give you reassurance. That will just make it worse. And now it has to be worked out with your family member. What is a health concern and what is not? Most times when I work with health anxiety, my client clearly knows. Most of them have been to the ER, multiple times, or a cardiologist or a cancer specialist, right? They have had multiple doctor visits. They know that the doctors don't find anything. They know that every test comes back fine. And so this is health anxiety that the family member can clearly say to them that I am so sorry, but I cannot give reassurance. There are some people that have real health concerns that also have health anxiety. And so that needs to be worked out with the loved one about what is a real concern, what is valid, and what part do we know from history is more anxiety related. And my last question comes from Camus 585. Thank you so much. This is by far one of the best videos about this topic. What other ways can we use exposure? I read that one way is to write the worst possible scenario and read it a few times a day until the anxiety is gone. What are your thoughts on that? I actually have a lot of thoughts on that. I do recommend scripts for health anxiety. Sometimes when I work with someone and we just stop the compulsive behaviors, all of that Googling, researching, body symptom checking, and excess appointments, when we stop those and they just tolerate that anxiety during those moments, their health anxiety comes down. Sometimes that's not enough. And so we will do scripts. Now, this is a script that I'm going to read that was written by one of my clients. I asked him if I could use his script in a video because I thought he did a wonderful job. And he very graciously agreed because he truly wants to help people. Now, I'm not going to read his full script, but I'm going to read a good portion of it. He recorded this script. He listened to it several hours a day, and it brought his anxiety down. So the script is, I accept that I have health anxiety. I may feel sensations or have worries about my health, but I will not act on these illogical worries. I will not check my body symptoms or sensations. I will not seek additional medical advice or medical tests unless they are advised by my physician. I will follow my physician's advice about how often I need to be seen in their office. I will not do any compulsive behaviors to help lower my anxiety, like checking blood pressure, pulse, oxygen saturation, temperature, heart monitors, or Google symptoms or illnesses. I will not seek reassurance of others. I have withstood every sensation and anxious state for over 20 years. I deserve to enjoy my life and not be consumed by my health-related worries. I know that health certainty is a myth for everyone. Life is uncertainty, and to fight that is foolish. I can and I will accept the sensations and the anxiety. In time, I will become more comfortable in the anxiety and thus removing the discomfort of it. So I hope that these questions today helped you. And until next time, I will see you in session. Take care. Bye-bye.